Welcome to Stellenbosch. Welcome to my Limb Lengthening 101 series, where we will explore the magical world of limb lengthening over the course of the next 9 episodes or so. This is Frans Burkholz from Stellenbosch, and today we're going to be talking a little bit around outcomes after limb lengthening. Of course, there are two main categories of limb lengthening. The one is the stature lengthening or cosmetic limb lengthening, and the other one is where we lengthen for discrepancies, where we equalize limb length discrepancies. Of course, if we're dealing with limb length discrepancies, we are trying to equalize the limb lengths, and if we can achieve that outcome, that's generally a good outcome, provided we can also return the patient to a high level of function. For cosmetic stature lengthening, the outcomes are defined slightly differently because it is a cosmetic surgery. There is a risk to function, but the intention is not to improve function. The intention is to improve stature and appearance and confidence and self-esteem. So the outcome in that context is pretty defined. If we can add a certain amount of height to a patient's body, generally we can take care of that expectation and we can take care of the self-esteem and the height dysphoria that is the cause of this situation. But it's really important to do this in the context of a safety envelope. In other words, what I mean with that is that we cannot achieve height at the expense of function. So it's really important to balance the outcomes so that we have, on the one hand, the desired outcome, in other words, the increase in height, but we do not compromise the patient's function in the process. We often get the question, but what about the long term? Is there a risk for arthritis? Is there a risk for functional impairment over the long term with limb lengthening? Now, it is difficult because we don't have large cohorts of patients that we followed up for 30 years beyond limb lengthening for stature reasons. So we don't really have that data on hand. But it is important to realize that as long as we stay within reasonable parameters and reasonable height targets, and as long as we do not cause significant malalignment, the expectation is that a patient would be able to return to a really high level of function and would be able to live a good life without any long-term compromise. So the risk for arthritis and other problems is really low. As with any surgery, it is really important to balance the benefit to the risk and to make sure that you as the patient understand that risk-benefit ratio fundamentally, and that you are happy to take the potential risk to gain the advantage of what a surgery could supply you with.